All right, kids, we are going to learn how to take care of a weak ankle, sprain, strain, sore, causing you grief just for, because it wants to, ankle situation. Okay? So, firstly, we want to take off our shoes. Anytime that you're doing anything to correct your feet or ankles, calves, knees, you pretty much want to do it with no shoes on. Shoes inhibit your range of motion. So we're going to wrap very simply the ankle. Like always, I recommend using kinesio tape that does not have pre-cut pieces. I always struggle with the first trying to open this stuff. Oh, well, let's see here. So, I do this every day, and if I'm having problems, you might have problems too. But eventually, we will get it. Maybe. All right, there we go. Now, what we want to do specifically if your foot is rolling inward, which that's the general issue, is we want to go right at the arch of the foot, and we're going to pull upward, and then we're going to go around the ankle, super easy, again, and then we're going to go around the foot again, and then up around the ankle again, and all the while applying a little bit of pressure. That would be it. Now, let's set up for our corrective work. You need to get a resistant band, kind of short, and we're going to be on our heels. We want to get our functional spacing. That just means that the heels are aligned with the knees and the knees are aligned with the hip bone. We're going to come and tie a knot. So we have a little bit of tension, not too much. Just remember, this is more for occupational therapy. We want to do this every single day, once only. 5 to 10 repetitions, begin with 5. And let's pull on and make sure that we are stable. All right, now we want to have both heels off of the side of a chair, pillow, bed, whatever. We're going to lean back. Now we're going to pull our legs apart, making sure that we have a pretend wall on the inside of our leg and feet. The knees are up to the ceiling, and we're going to start with the affected foot. I'll show you a little bit of side. And we're going to go into our otter. So it's just a little flick. Make sure that we do not slingshot back. And only the foot moves. So we're hard flex. Nothing moves. Knees are straight up to the ceiling. And then you can go to the other side if you want to, but it is not necessary. So if you only get 5 and your goal is 8 for the weaker side, do the exact same amount of reps for the strong side. All right. Now that we're done with that, we need a very long resistant band. We're going to place it around the top of the foot. Extend that leg out again over the side of whatever you're using, or if you're on the floor, use a yoga block or a pillow. And we want to pull back, so we want tension. Now we still have that imaginary wall right here, yeah? And we're going to point and flex hard. Point. And we want to get into a good point, so there you go. Move that band up higher and cover the toes. Now be aware that the arm that's holding the cable is not moving back and forth, because that's your arm doing the movement, not your foot. So we went hard, flex, hard point. And again, 5 to 10 repetitions. That's it. Do this every single day, only once. We do not want to get too sore. Mildly is okay, because this is going to strengthen us. And if you get too sore, your body's going to revert back to the path of least resistance. We don't want that. That's what we're trying to correct. All right. Now, as soon as you are accomplishing whatever it is that you're trying to accomplish with these 2 movements, please continue doing it for 14 more days, just to make sure that you have corrected the problem and you're getting strong. If it's for strength, continue doing it if the pain goes when the pain goes away, and then go your 14 days, and then do it about 3 times a week until we get stronger, or as strong as you need to be. All right, that'll do it for this time. Until next time, happy strengthening.